Good afternoon to all. So today we are having with us Dr. Jasprit Singh Ved sir. He is an associate professor in the University College of Physiotherapy at Baba Farid University of Health Sciences, Faridkot, Punjab, where he teaches and mentors the student in physiotherapy and rehabilitation sciences. He holds a Ph.D. and has contributed to numerous research publications focused on the rehabilitation intervention, including the studies on the spinal cord injury recovery, cerebellar ataxia, and hydrocephalus rehabilitation, as well as practice in the post-stroke therapy and functional recovery. So Dr. Vij's work bridges clinical practice and academic research to improve the patient outcomes in neurological and musculoskeletal conditions. So he is active in academic publishing and participates in professional discourse on physiotherapy advancement within India. So we welcome Dr. Jasprit Singh Ved sir. So now I think so we can start with the scholar. Thank you.
May I start, sir? Respected chairperson and panel members, I am Som Gupta, and today I am presenting my research in front of you. So the title of my research is ISOINERTIAL Training for Eccentric Strengthening in Anterior Cruciate Ligament Reconstruction Surgeries. So experimental trial, and my guide for this study is Dr. Ramesh Chandra Patra, who is Associate Professor in lovely professional university, sir. So sir, before starting my presentation, I would like to express my gratitude to the honorable reviewers and panel members of my pre-submission who reviewed it and recommended my results, sir. So sir, your valuable feedback and encouragement have greatly contributed to the refinement of my study, and really thankful for that, sir. This is my result for pre-submission. Sir, my research on the role of isoinertial training for eccentric strengthening in anterior cruciate ligament reconstruction surgery, sir. For this topic, sir, I reviewed 757 articles were retrieved and screened, sir, for the same. And out of those which were meeting with the criteria of my objectives were taken out, sir, and accordingly, so detailed analysis was done from that, sir. So the article was sourced from multiple academic databases, sir, including PubMed, Scopus, CINAHL, and Google Scholar, that ensuring a comprehensive and systematic coverage of available literature that helped in identifying key information, the methodological approaches, and research trends relevant to the studies. So sir, based on the extensive review of the literature, it is evident that several rehabilitation protocols have been developed for patients undergoing anterior cruciate ligament reconstruction surgeries. Isoinertial concentric eccentric maximum exercise sessions are effective in reducing clinical signs of muscle damage and delayed onset muscle soreness. Because of these benefits, isoinertial training is increasingly being incorporated into the post-surgical rehabilitation protocols. Many studies reported, and it was observed, only a limited number of studies have implemented rehabilitation using a combination therapy approach, sir, in which there is eccentric work as well as conventional rehabilitation was implemented. In particular, there is lack of research focusing on the combined effect of isoinertial eccentric strength training integrated with other rehabilitation interventions after ACL reconstruction surgery. Therefore, there exists a clear research gap regarding the effectiveness of combined rehabilitation strategies involving isoinertial training for eccentric strengthening in post-ACL reconstruction patients. So sir, there was a need for this study arise from the critical role of eccentric muscle function that plays in human movement, sir. particularly during high force and fast stretch shortening cycle activities. So sir, these movements are fundamental to any athletic performance, especially in actions such as jumping and sprinting, sir. Furthermore, the role of isoinertial eccentric overload strength training within post-ACL reconstruction rehabilitation program, that remains unclear, sir, in literature. So there is also lack of well-defined reference interventions that can guide clinical and rehabilitation practices, sir. Therefore, it is essential to clearly elucidate the role of eccentric muscle function in functional performance and to develop evidence-based rehabilitation strategies that incorporating isoinertial eccentric training for individuals who are recovering from ACL reconstruction surgeries, sir. So about the background of his study, sir. So sir, ACL, that is anterior cruciate ligament, that injury often results in range of impairments and disabilities that significantly impact an individual's daily life and physical function, sir. The immobilization of knee joint after ACL reconstruction result in muscular atrophy and limited range of motion of the joint. Thus, the rehabilitation treatment is a decisive factor for any functional recovery of knee joint and the functional performance of the individual or a player. Eccentric training has demonstrated the potential to enhance muscle strength more effectively with less energy expenditure. While studies have explored its benefit for other conditions, there is gap in evidence regarding its effectiveness in particularly ACL reconstruction surgeries, sir. For this, my research question came out, sir, whether the isoinertial eccentric strengthening in combination with conventional rehabilitation protocol will increase the muscle power, endurance, isometric strength, balance, knee-related quality of life and function in patients with anterior cruciate ligament reconstruction surgeries, sir. Then, sir, primary objectives were to assess the effectiveness of isoinertial eccentric training on muscle power, isometric strength and endurance in patients undergoing anterior cruciate ligament reconstruction surgery in conjunction with a traditional rehabilitation program, sir. Also, to evaluate the effect of isoinertial eccentric strengthening versus traditional rehabilitation routine on muscle power, isometric strength and endurance in patients who have undergone anterior cruciate ligament reconstruction surgeries. Secondary objectives were to assess the effectiveness of isoinertial strength training combined with traditional rehabilitation protocols for patients who have undergone anterior cruciate ligament reconstruction surgery and main focus on the balance, knee injury and osteoarthritis outcome score, knee related quality of life in which Cincinnati knee rating system and Oxford knee score, sir. Also to evaluate the impact of combining isoinertial eccentric strength training with conventional rehabilitation protocol compared to conventional rehabilitation protocol alone in patients who have undergone ACL reconstruction surgeries, and again focus on balance, knee injury and osteoarthritis outcome score, knee related quality of life and Oxford knee score, sir. Hypothesis that came out, sir, was focused on the effect of isoinertial eccentric strengthening in combination with conventional rehabilitation protocol in patients with ACL reconstruction surgeries. The effect on muscle power, muscle endurance, isometric strength, balance, knee related quality of life, pain and functional outcome of the knee, sir. Methodology that was opted for this research was, it was like the study design was experimental design, and the population was post anterior cruciate ligament reconstruction surgeries. Study setting was the Department of Physiotherapy. Sampling method was simple, random sampling was done, and the sample size 96. Treatment duration was 6 weeks, sir. Sir, in procedure, sir, the patients were the 2 familiarization sessions of isoinertial training program was done, so that patient will come to know about how to manage the device and how to do the exercises on the device. So firstly 2 familiarization sessions were done, then pre-test sessions was done, sir. All patients were we enrolled patients 3 weeks post-operatively. The first assessment was taken when patients were 3 weeks post-operative. Then after pre-test, with 96 subjects out of 130 screened subjects was selected for 2 equal groups, sir. Then randomization was done. The lottery method was used for the allotting the groups, Group A and Group B. Two groups were made, sir. Group A with number of 47 and Group B number 49. Group A was the experimental group, sir, in which patient received 6 weeks of conventional ACL rehab along with 2 sessions per week of ISOINERTIAL training, sir. That was the experimental group, sir. In conventional group, 6 weeks of conventional ACL rehab protocol was carried out, sir. And the final assessment taken 6 weeks post-intervention. Means patient was in the 9 week of post-operative and the intervention was for 6 weeks, sir. So first reading was taken on 3rd week and then 6 weeks of intervention. On 9 weeks, second reading was taken, sir. The statistical analysis was done. So in my study, the variables were ISOINERTIAL training and eccentric overload was the independent variable, while the dependent variable were power, endurance, isometric strength, balance, Coos score, CKRS and Oxford knee score, sir. Instruments and tools that were used for data collection. So these were the scores, sir. Knee injury and osteoarthritis outcome score, Cincinnati knee rating system, Oxford knee score, and the flywheel ergometer that was D11 plus Desmotec from Bela, Italy. It is for ISOINERTIAL training, sir. So, sir, in results, the baseline characteristics of the participants of the study were taken, sir, to see the homogeneity of the group, sir. So, in which age, height, weight, and BMI was taken for Group A and Group B. In Group A, the mean age was 29.94 plus minus 6.78 standard deviation, and Group B 30.20 plus minus 7.45. And the the p values were non-significant, sir. Same for height, weight, and BMIs. The p values were found, sir, non-significant. Baseline characteristics of male and female participants of study were also taken care, sir, just to see the equal ratios of males and females in the groups, sir. So the all male and females participated in the groups. The age, height, weight, and BMI, that were again p values were non-significant, sir. Again, sir, muscle power concentric, muscle power eccentric, endurance, and isometric strength was evaluated, sir. In which Group A, the mean was 79 watt plus minus 19.35. Group B, concentric power 80.61 plus minus 25.78 with the t value 0.35 and the p value is 0.73, which was non-significant, sir. Same in muscle power eccentric. So the Group A, the mean values were 80.79 plus minus 17.80, while for the Group B 87.04 plus minus 17.87 with the t value 1.72 and the p value is 0.9, in non-significant, sir. Endurance, isometrics, both the p values were found, sir, non-significant, sir. For the balance, Coos and CKR scores, sir, Group A balance were found 6.54 plus minus 2.71, 7.16 plus minus 0.27, one with t value 1.26 and p value 0.21. Again, all parameters were found non-significant, sir, and this shows the homogeneity of the demographic features of the group, sir. Effect of treatment. Now come to the effects of treatment in Group A participants. Group A is experimental group, sir, in which the patient received conventional rehabilitation program along with 2 sessions per week of ISOINERTIAL training programs. So in Group A participants, sir, week 0 muscle power concentric was found, sir, 79 plus minus 19.35, and on week 6 the muscle power that came 173.53 watt plus minus 49.91. In eccentric group, again 80.79 plus minus 17.80.
No need to have the values. You don't need to speak the values. You can just say which is significant, which is non-significant.
Okay, sir. So in Group A participants, the results were at week 0 and week 6. So we found the values were totally significant, sir, because we can see a rise of confidence interval also. Also the effect size, Cohen's d, is a large number, and the p-values were found significant post intervention, sir. Then we compared balance, Coos, CKRS and OKS. Again, all values with a good effect size and confidence interval, p-values were found significant, sir. Then we studied, sir, group A male subjects only, sir. So in group A male subject, again with good confidence interval and effect size, the p-values were found significant, sir. For muscle power, both concentric as well as eccentric, endurance, isometric strength, balance, Coos, CKRS and OKS, sir. In male subjects also, from group A, all values were significant, sir. So for group A female subjects, sir, again muscle power, concentric, eccentric, endurance and isometric strength. So the all values were significant, sir, pre and post intervention, sir. So again, balance, Coos, CKRS, OKS. So the values of p-values were found significant, sir. So there was significant improvement pre and post intervention, sir. So sir, we compared the based on operated side also, sir. If the patient is having dominating side operated or non-dominant side operating, sir. So in the patients with dominating operating side, in group A, where the experimental group was there, so again muscle power, concentric, eccentric, endurance and isometric strength, so all values were, the p-values were found significant, sir, when the patient were operated on the dominated side, sir. And if you see the values, yes sir, again balance, Coos, CKRS and OKS, all values were, sir, found significant both for dominant side and the non-dominant side, sir.
So it means all the parameters in the group A were significant.
Yes sir, all the parameters in group A found significant, sir. So now, sir, if we'll talk about group B, which is the controlled group, sir. Control group in which the only conventional rehabilitation program was carried out. So here muscle power, concentric, eccentric and endurance and isometric strength were evaluated, sir. So in group B, again all values were significant except, sir, endurance part, because muscle power, concentric and muscle power, eccentric were improved significantly in group B also, but endurance, there was improvement in endurance, but it was not within the significant limits, sir, that the p-values we settled, sir. So it found non-significant, while isometric strength, muscle power, concentric and eccentric was found significant, sir. Again, same for the balance, Coos, CKRS and OKS, all values were found significant, the p-values were significant in group B, sir. So in group B male subjects, again all values were significant except endurance parts, sir. Endurance improved, but it was not a significant improvement, sir, that seen in endurance. Muscle power, concentric, eccentric improved with the p-value, t value of 15.38, and in eccentric part the p-values found 18.77, sir. Balance, Coos, CKRS and OKS again improved significantly, and the p-values were found significant, sir. So this is the chart for the group B female subjects, sir. All values were significant except endurance, sir. Balance, Coos, CKRS, OKS, all values found significant on the p-value, sir. If you talk about dominant operated side and versus non-dominant operated side, sir, in group B. So here all values found significant, even endurance found significant in the dominant side groups, while endurance found non-significant, sir, in non-dominated side operated patients, sir. And the values of CKRS, Coos, balance and OKS were found significant on the p-value, sir. So now we did the comparison between the groups, sir. So these were the charts showing the comparison of groups, comparison of mean values of muscle power at 0 versus 6 weeks interval within group A and group B. Comparison of endurance, group A and B, isometric strength, balance, COOS, CKRS and OKS, sir. So comparison of muscle power, isometric strength and balance at 0 versus 6 weeks interval between group A and group B, sir. So in comparison, sir, we found muscle power concentric was 94.53 plus minus 3.39.47, while group B it was 91.90 and 35.52, sir. The T value was 0.34 and the P value was non-significant, sir. Means improvement happened in both groups, sir. And eccentric power, the difference in eccentric muscle power was significant, sir. When we compared both groups, the experimental group showed the better improvement in eccentric muscle group of muscle power, sir. Isometric strength improved in both groups, sir, with the P values were non-significant. Balance improved in both groups, sir. P values were non-significant. COOS, CKRS and OKS, they improved in both groups, sir, with non-significant P values, sir. So comparison of mean values of muscle power, 0 and 6 week interval between group A and group B, balance, COOS, CKRS, OKS. So these were the graphical representations. Now we'll come to the conclusion, sir. Both the groups, group A and group B, showed improved muscle power, concentric and eccentric, sir. However, in terms of eccentric muscle power, group A proved efficacious, sir. Group A, which was the experimental group with both conventional and isoinertial training. With regard to endurance, group A proved to be superior than conventional rehabilitation protocol only, which was group B. In terms of operative dominant side, group A showed substantial improvement in endurance, while other parameters improved for both the groups, sir. Both interventions were effective in improving isometric strength and balance, with none proving more effective than others, sir. In terms of knee-related quality of life and function, both interventions were effective, with no superiority observed for either of the groups, sir. And both the interventions proved to be efficacious in terms of pain and functional outcomes of the knee, but neither proved superior to others, sir. So my limitations of the study, sir, the therapists were not blinded to the group allocation, possibly influencing the outcomes, sir. The study did not directly compare the isoinertial training protocol with conventional rehabilitation protocol. So because we were comparing, sir, conventional both with additional isoinertial, sir. So that limiting the evidence for its distinct effectiveness. A small sample size and limited geographical scope restrict the generalizability of the study. The inclusion of both athletic and non-athletic individuals led to the lack of homogeneity. And sir, it is a single center study and the patients were from the Punjab region, which may limit the generalizability of the results to a broader population or other geological regions, sir. For the clinical implication, incorporating isoinertial eccentric strength training into conventional rehabilitation can significantly improve muscle power, especially eccentric strength, that is crucial from recovery of the knee injuries. Emphasizing both concentric and eccentric muscle performance in rehabilitation protocols can target specific muscle imbalance, and comprehensive rehabilitation programs that include evidence-based intervention can enhance recovery and optimize the outcomes, sir. So these are references are used. So I presented in conferences, sir, and papers were published in reputed journals, sir. So these were the assessment forms, sir, used for the patient. And the patient information sheets, both in all three languages were there, sir, English, Hindi and Punjabi. The consent forms. This is the ethical approval from the institutional ethical committee, the data collection form. score, sir, CKRS, and this OKS score, sir. Thank you, sir.
Michael?
Basically the topic is of quite clinically significant importance because these injuries are very common.
Sir.
So in the presentation you have missed the discussion part.
Okay.
In the thesis it is there, but you I think somehow missed the discussion of the results, because discussion of results is an important component in the presentation.
Sure.
You have to discuss why, if something becomes significant, what was the reason, what was the logical explanation. So I think you missed the discussion component in the presentation.
Oh, okay.
Okay, what was the reason that, endurance came to be non-significant, only one parameter in the second group, in the conventional group? What was the possible explanation for that?
Sir, eccentric muscle groups, because in my study it was proved, with the results, it was seen that eccentric muscle power was increasing, giving good results with the intervention, sir. And what we see that if you are having strong eccentric muscle group, eccentric muscles are basically deacceleration muscles, sir. So whenever any person, any athletes get into the deacceleration phase, then eccentric muscle component works a lot. So with this device, with this isoinertial technology, we are able to improve the eccentric muscle part, sir. So that was the probable reason to increase the the endurance part also, sir. Because with eccentric, you are landing into the controlled movements, sir. And when the movements are controlled, so the endurance to work in a specific range, specific zone, that increases, sir. So the effectiveness increases with the increase in the strength of eccentric muscle group or the control of eccentric muscle group, sir. So
Okay.
probably
Do you
this
have any previous literature which support this claim?
regarding, sir?
Any previous study which support you this claim regarding this, the explanation you gave? Any previous study which has supported the same thing?
Yes, sir. Previous studies are there, sir. So I have given the references, sir. So but not shown here, sir.
So that is why actually in discussion it all comes.
Yes, sir.
Okay. Okay. How many dropouts were there?
So practically no dropouts.
No dropout. All the patients completed the study.
Yes, sir.
Okay. And all these, like they were post-surgical patients.
Yes, sir.
So they were surgical intervention was done at the same one center or from the different centers?
Surgical intervention was done at the same center. Same graft was used. That was semitendinosus and gracilis graft, sir. Double standard graft was used and done at the same center by the single surgeon, sir.
Same surgeon performed.
Same surgeon performed all the cases, sir, with the same kind of graft and same setting, sir.
Okay. And what was the total duration of data collection?
So data collection was done for 3 years, sir. Around between 2020 to 23, sir.
2023.
Yes, sir.
Okay. And the patient population, they were athletes or general population?
Sir, it was more of a general population, sir. Not much athletes were there, sir.
But some athletes might be there.
Might be there, sir, but majority were, sir. Well, we have not excluded it, but the majority were.
How many maybe athletic population? How much out of the total?
Sir, here in our setting, sir, we don't get many athletes, sir, because our setup is like this only. So we in our central we are having a lot of surgeries, but athletic populations, athletic means purely professional athletes. So I'm talking if you say athletes, so I'm understanding, sir, with the professional athletes, sir.
Yeah.
So no professional athlete was there, sir.
Okay, what was the your criteria for getting a review of literature, for selecting the literature review? Any criteria you made regarding the previous work? You made any plan so that you covered all the aspects of review of literature?
So the keywords, sir.
Okay.
So we explore the keywords, sir. So accordingly.
Any time frame that from this year to this year you will select the literature review?
Sir, even till last year also, sir, before my pre-submission, sir. So till that we explored the reviews.
No, latest is you have to do, but how much all the literature you included? From which year to which year? You can include till 2025, that is not an issue. But you started from which year? From 2000, 2010, 1980s, 1990s?
Sir, 10 years papers were explored, sir.
10-year papers.
Yes, sir.
Okay. Okay, any particular reasons for not blinding the assessors? For
the treatment, sir?
No, for outcome parameters, for assessing the outcome parameters. Because treatment you gave.
Yes, sir.
But if blinding might have been done, it would have increased the credibility of the study, like blind assessors, those who are assessing, maybe before and after intervention.
So the people are not trained for the for handling that gadget, sir.
Okay.
So that's why I did it by myself, sir.
Right. And any of your questionnaire, they are self-filled questionnaires or basically patient-filled questionnaire, or you fill the questionnaires like outcome parameters? Any?
Sir, all are that standard question, the patient-reported outcome measures.
Patient reported. So
Patient reported.
language is not the issue.
Language is not the issue because we got in all languages, sir.
Okay.
But out of these many patients, language barrier was not there.
Okay. So it means as per your outcome parameters, your conclusion, that both are equally effective, but
Yes, sir.
eccentric is better as compared if you want endurance.
Yes, sir. So in both were equally effective. Equally effective in the sense that both all parameters were improved in both the groups.
Almost all.
Both the groups, but the eccentric power was improved better than group B in case of experiment group. Same way endurance was better in that group, sir.
So who will benefit most from your research?
Rehabilitation protocols, if we include this rehabilitation protocol in ACL, because sir, post ACL in general scenario, patients are not doing much of post-operative rehabilitation, sir. So the major component after ACL reconstruction surgery is the muscle wasting and the back to the sports problem, sir. So patients, if they are not a sportsman even, so they are not using their limb to the fullest because of the patients are satisfied whatever they have achieved. But the muscle girth is definitely less in patients who are not undergoing the full-fledged rehabilitation, sir. And the girth part will be benefited with the eccentric muscle group, sir. So in my opinion, if this protocol is used for post-operative rehabilitation, so it will definitely help individuals to get a good rehab plan, also early return to their workplace or the sports or the functional recovery will be better, and the chances of re-injury will become will be very less, because if the de-acceleration phase is getting better with eccentric strengthening, so then definitely it is going to help them in preventing re-injuries and early functional rehabilitation, sir.
Can this protocol also prevent ACL injuries? What do you think?
Yes, sir. Because ACL injuries are, again, as I told you, sir, ACL injuries, but we have seen in literature also, it's a de-acceleration injury, sir. Whenever a person, either athlete or non-athlete, whenever he is running or walking or sprinting at a speed, immediately if he de-accelerates himself, and if the eccentric muscle group is not holding the joint to the fullest, so there is a rotational injury, sir. So generally this is the main cause of injuries. Like in basketball players, sir, whenever the player is basket, he run with a full speed to the basket, and when he basket and suddenly when he lands on the ground is a stationary surface, sir. So there is very less, there is immediate de-acceleration of the whatever the muscle has been activated, sir. So in that case, and suddenly he need to rush back to his own court, sir. So he de-accelerates, knee comes into the flexion, but the de-acceleration, because the eccentric muscle, if it is not strong, so it is not holding the joint, and then the player suddenly twists to move back to his own court. So then generally ACL injuries happen, sir. Same we seen in football also, sir. So whenever some other player is countering the leg, so the player is in full momentum, and whenever there is a counter on the leg, because they just hit on the leg, sir, so suddenly there is a stop of the movement, sir. So when de-acceleration is there, again role of eccentric group is predominant, sir. So if we enhance the eccentric muscle group using these protocols, so it can definitely help in preventing the injuries also, sir.
Okay. So any objectives of the study which were not met as per the results, or all the objectives were achieved in your results?
Sir, I was expecting better outcomes in almost every component, sir. So I was expecting it. If it is increasing, then the all value should come significant, sir. So like concentric also, yes, eccentric is significant, sir. Other than eccentric, sir, other parameters were improved, but it was not very much efficacious than what I was thinking, sir.
Any questions from the house?
Sir.
You have not included any image of any patient or any video in the PPT. What is the reason?
I have some few pictures in my system, sir, but I have not included it because I thought because of some privacy issues we should not disclose it. But
All the face, no issue.
I can show you, sir.
Okay, I will see.
Okay.
And how do you randomize the samples, sir?
Randomize
Using
this,
the which method?
sir. We use the lottery method, sir. Same group A and group B, sir.
Okay.
So the patient take the slip and accordingly we allocate the group, sir.
Means 1:1 parallel arm you done ना?
Yes, sir.
उसमें जाना एक बार वो जो आपका है फ्लो चार्ट, अगर 1:1 आपका पैरेलल आर्म चल रहा है तो उसमें ग्रुप में फिर डिफरेंस कैसे आ गया पेशेंट का? एक साइड पे 49 है, एक साइड पे 47 है और आपका ड्रॉप आउट भी कोई नहीं है यहाँ पे, तो ये डिफरेंस कैसे आ गया?
सर वो पेशेंट की स्लिप जो हम स्लिप्स डाल रहे थे, सर वो स्लिप्स पेशेंट पिक कर रहा था जी।
नहीं 1:1 आप बोल रहे ना कि आपने फॉलो किया है मेथड, दो पेशेंट आपके पास एक टाइम पे आ रहे हैं तो उनके सामने आप ग्रुप ए और ग्रुप बी की स्लिप रख रहे हो और दोनों उसको उठा रहे हैं, तो एक बंदा ग्रुप बी पे चला गया, एक ग्रुप बी पे चला गया, फिर तो इक्वल होना चाहिए सैंपल साइज दोनों साइड का, फिर तो कोई ड्रॉप आउट तो हुआ ही नहीं आपका, रैंडमाइजेशन के बाद कोई ड्रॉप आउट नहीं हुआ, तभी ड्रॉप आउट होता तो ही आपका वन साइड कम हो सकता था।
आई थिंक उसको ना वो आखिरी में शायद कुछ सिंगल पेशेंट भी आए होंगे, कोई जैसे एक पेशेंट आया तो एक उसका चांस ज्यादा एक ग्रुप में जाने में था।
एक्चुअली ये एनालाइज्ड सब्जेक्ट होगा, ठीक है, 130 जो लिया है उसको डिवाइड करना था।
नहीं
दिस इज एनालाइज्ड सब्जेक्ट, ठीक है, लास्ट में ही आया था, बीच में छोड़ दिया, शायद टाइमिंग एरर है।
नहीं, अलग अलग है, डिफरेंस तो है, मतलब दोनों का गैप है।
तो 48 होता है।
हाँ, इधर सर इक्वली डिवाइड किया, बीच में से कोई छोड़ के चला गया, उसने आया नहीं, पेशेंट होगा
नहीं सर,
ऐसे कुछ है।
नहीं, ड्रॉप आउट
तो नहीं था।
Saying there is no dropout, no?
अच्छा,
आई थिंक प्रॉब्लम तब ये होगी जब सिंगल पेशेंट आया होगा,
लास्ट में
3 पेशेंट्स आए हैं, तो लास्ट में जैसे 3 पेशेंट्स आ गए होंगे तो नेचुरल है कि एक 2 में जाएगा,
सर,
एक ग्रुप में 2 जाएंगे। But ideally, best method is computer based. That is the best method.
Okay.
आजकल वही फॉलो होता है मोस्टली, computer based.
आपने इसमें एक तो मेल फीमेल का भी कंपेयर किया है, लेकिन आपका कहीं पे भी वो ऑब्जेक्टिव में नहीं था या कुछ भी नहीं था वो।
Sir, well, that was suggestions received from previous evaluations, sir.
Okay.
So last evaluation, after the last evaluation we added sir male, female and dominant, non-dominating side, sir.
ओके, मतलब पहले से नहीं था।
नहीं सर, वो पहले नहीं था सर।
और इसमें आपने स्टडी साइड में एलबी लिखा हुआ है
सर,
वो तो आपका एलबी नहीं है ना, वॉशी से आई।
सो सारा काम तो हम डॉक्यूमेंटेशन वगैरह सब यहीं पे कर रहे हैं।
नहीं, सेटिंग होता है जहाँ पेशेंट्स असेस कर रहे हो, ट्रीट कर रहे हो आप, सेटिंग।
नहीं हो गया, उसके बाद महाराष्ट्र में एक केस था ना, एक्चुअली वी हैव वेरी गुड रिलेशन विद स्कॉटिश हॉस्पिटल, ठीक है।
वो तो सर MOU तो है ही है सर, पर
एक्चुअली वहाँ
आई थिंक इट शुड बी बोथ होना चाहिए, LPU प्लस।
लास्ट टाइम भी जब EDP हुआ मैंने उस टाइम सजेस्ट किया था दोनों का नेम ऐड करो।
सॉरी सर आप कह
ना वहाँ से भी अपना NOC लेना पड़ता है, हमने बहुत कोशिश किया लेने के लिए। शुरू में तो 6 महीने से ही लगा गया था,
बिल्कुल सर।
कुछ मिल जाए वहाँ पे देखने में लोग फिर कुछ मांगते हैं।
But otherwise, it's a good study, good work also.
Thank you,
and
sir.
many patients and clinicians will definitely they will benefit.
थैंक यू सर।
Because in Indian setting, we don't have a fixed protocol for these patients.
This gadget, no idea. Cost around 8 to 9 lakh.
I think this topic have future
22 lakhs
prospects,
sir, 22 lakhs sir।
Sorry, I'm sorry.
and this topic has future prospects also regarding.
Yes, sir।
So exactly that was my question. I was about to ask कि आपने identify करा कि what should be the future work where you have ended, what are the future directions in which.
So future directions, the one future direction that has to be sir, we have to evaluate patients after six months or 3 months also sir, same patients. If we evaluate them further sir, so then we'll come to know about whether that the effect of that hypertrophy or muscle strength effect we are getting with this after 6 weeks of intervention. So how much they are lasting sir. So if patient is not doing any exercise after that, so whether it is even effective or not sir, so that thing can be evaluated sir।
Good.
एक बार वो इंग्लिश से हाउस में हमें समझ आएगा किया गया है इसमें आपने।
सर मैं आपको इस उसमें लग नहीं रहा, इसमें दिखा दूँ सर।
वैसा दिखाओ। और मशीन देख रहे हैं क्या है?
हाँ जी सर।
मशीन का बहुत
Patients का आपको ऑन कैमरा तो नहीं करते जाना, प्राइवेसी इशू हो जाएंगे।
ना सर मैंने फिर भी ना इसकी वो बना दी थी PPT एक ना।
वीडियो भी था, वीडियो
सर दिस इज द मशीन सर। सर बस
वीडियो है?
हाँ सर मैं दिखाता हूँ, वो दिखाता हूँ सर। ये तो कुछ पेशेंट्स थे जी
दिस इज द
सर। So this is concentric, eccentric is working sir. So patient, this consent eccentric sir, concentric eccentric sir. So this is revolving, that is flywheel concept sir। So here sir we can have lot of eccentric overload also sir. If we ask patient to stop in between sir, there is a lot of overloading to the muscle sir। So this is a sir। These are the videos sir।
So we can conclude the today's presentation. So I congratulate Som Gupta for successfully defending the Viva Voce examination
Thank you sir।
and completing the entire PhD program.
Hi।
From now officially you have completed it, and the doctor of philosophy you can write doctor now, no issues.
Thanks a lot sir।
Many congratulations.
Thank you sir। Thank you very much sir। Thank you। Thank you sir।
So PhD doctor.